to travel, journey, voyage, expedition, tour, pilgrimage, safari, odyssey, to boldly go where no one has gone before.
Welcome to our podcast, Travel Unraveled, an ISTM podcast sponsored by the International Society of Travel Medicine and IAMAT, the International Association for Medical Assistance to Travelers. So we are here today in Toronto, Canada at Assunta Marcolongo's house. Very much an honor to be here. And Assunta is the director of the International Association for Medical Assistance to Travelers, or IAMAT, who have generously funded and sponsored our podcast, Travel Unraveled, an ISTM podcast. And the reason we're here today is Assunta actually has a very interesting history, and her late partner, Dr. Vincenzo Marcolongo, would be considered to be one of the grandfathers of travel medicine and one of the founders of travel medicine. And so we're here today to learn a little bit more about that and a little bit more about the history of IAMAT and her adventures traveling through the world, collecting information that we now use as a foundational framework. Anne, did you want to say anything as well?
I'm Anne McCarthy. I'm president-elect for ISTM and have been lucky enough to be part of these podcasts with Aisha, and very, very happy to have Assunta here, who's been a long-time friend and colleague through both the ISTM and the American Society of Tropical Medicine as well. Welcome, Assunta. Thank you very much for welcoming us into your home. I wanted to start by asking you about what was the driving force for you and your husband to think about doing something like the International Assistance to Medical Advice for Travelers?
Thanks, Anne, and welcome here to my house. Vincenzo was trained at McGill. He came to McGill with a scholarship and went back to Rome, where he was from, and he became a doctor to many hotels and also to the embassy. Not directly, but the embassy would refer him patients.
How you guys built such an international network, and then how you became such a huge foundation that had such a huge impact on the travel medicine field. And really, I would say that, you know, Dr. Vincenzo Marcolongo is probably one of the founders of travel medicine, one of the grandfathers of travel medicine. And I just think it's someone that I think we should not forget about to see what he laid down in regards to frameworks, because, you know, it's interesting being part of CatMat now and seeing kind of the mapping that we see the CDC do in CatMat and different organizations. He was doing this by paper, right?
Yes,
like he was doing this by hand. He was drawing maps.
Yes, I was actually drawing all the maps.
You were drawing the maps.
Yeah. And okay.
So, I mean, I just want to hear about this history and what the experience was like, and I wanted to document it, right? Like, I think it's important history that we really should not forget about.
I had a cabinet full of maps from all over the world, and I would go read medical papers, and then there is malaria. I would make points, and I drew all these maps.
It's amazing.
So how would you... so you would go to these countries, and then how would you find these malaria areas? Like, would you test the mosquitoes, or what would you be doing?
We didn't do any testing, but we read all the literature within the country. You know, for example, like I said before, in Philippines, there was a wealth of information in Spanish, you know, but nobody knew it in the English-speaking world, you know. We knew there was malaria, but exactly where, which islands, and so on.
Yeah, and I think that's one of the things that you guys always worked hard on, was truly knowing as much as possible the geography of the risk. So very helpful for travelers, because they could have back in the day, their paper map with them of that area and say, okay, I only need malaria prophylaxis or take malaria pills when I go to this little region. I'll do that at the end of my trip. I don't need to take them all the rest of the time, right?
Yes,
So
yes.
I think it made
Yeah.
a huge difference, had a huge impact.
Yes, I think so. We tried to be as specific as we could.
Yeah, within the parameters.
Yes,
right?
yes,
Yeah.
yes. And don't forget, this was before internet and before we had all these maps online, you know.
So you were telephone and writing letters or typing letters, right?
Yes,
The other thing that I think is very impressive is just the to be brave enough to go to all these organizations and ask for this information. And people are saying, like, who are you? Why do we need to give you this information?
Yes.
I mean, once you became established, it was different.
Yes. Yes. For example, I was many times at the World Health Organization, and one time I went to ask about dengue fever in Thailand, which is still a huge problem. And the person there in charge was a Thai person. And he said to me, well, I have to ask my government if I can give you this information. I said, thanks very much. And I had to leave, you know, because there was nothing written about it. But we knew there was a lot of dengue.
Yeah. So when you would go to, you'd go to the World Health Organization, and then when you would go to other countries to look for different things, would you usually start with the WHO representative in that country, or what would you start with?
with connections with doctors.
So what were the main documents or publications that you were creating? Was it information for travelers, or was it map documentation?
It was information mainly for travelers, but we wanted it as accurate as possible, so it was also interesting for providers about immunizations, about where malaria is, that providers knew exactly where their travelers went to. They could give some more information, you know. So it was a two-way street. But we also wanted that normal travelers can understand what it is about. For example, our schistosomiasis risk chart tells there in Africa and Brazil where you cannot swim. And there was no medication against this disease, but it was important that the traveler knew where it was, not just the provider.
Yeah. I mean, and you think about now the tropical medicine training that we do, I didn't learn about a lot of these diseases until I went and trained at, Gorgas in Peru to learn about these. So I can imagine that this was valuable information even to providers in places like, Yale and Cornell and whatnot, who may have not gone to these places, who have never heard of these diseases before.
Yes.
How did you come to learn about them? So did you discover them when you were traveling, or did Dr. Marcolongo already know of them, through his studies?
Yes, he was a specialist in tropical diseases, and he had received his degree from Rome University in tropical diseases. And he read so many tropical diseases manuals and books, and he knew about this, and then naturally we traveled. And he had a very problematic case. It was a Canadian music student who became very ill because she was given aminopyrin by a dentist, and he saved her life because he knew this medication was banned in Canada, as it is harmful to people of English descent and Scandinavian descent.
And it's harmful to their bone marrow.
Yes,
right?
yes. And he was very lucky that he could save her life. And because of his work in Rome, he knew that many people were getting sick around the world. And he started to organize doctors around the world. And in 1964, he came back to Canada, and he published his first list of physicians around the world who would treat travelers.
And so that is how the beginnings of IAMAT started.
And then we realized just giving information about where to find a doctor wasn't good enough. We had to prepare travelers to go overseas with vaccinations. They had to know where malaria was, other tropical diseases, because nobody had any information about this. And doctors in many countries didn't speak English and couldn't explain what happened to travelers. And vice versa, travelers came back and the doctors had no clue where they had been and what illnesses they brought back. So we started to have a world immunization and malaria risk chart, and we started to have a publication called How to Protect Yourself Against Malaria. And then we came out with a schistosomiasis risk chart. This is a Snell disease, which is present in fresh water in some countries, especially in Africa and in Brazil. We came out with a Chagas disease risk chart, which is a disease which was very common in South America.
And still is.
Yes.
Yeah. So, I mean, this was in the 60s.
Yes.
Pre-internet,
Yes.
pre-cell phone, even fax machine.
We wrote letters, tons of letters.
Yeah, because you couldn't afford the phone.
No,
it was too expensive
it was
to phone.
very expensive. Yeah.
But then how did you source this information? So how did you figure out where the malaria was and where schistosomiasis was in Chagas?
We contacted British, Canadian and US embassies with questionnaires about malaria, about what diseases they encountered, and also what condition of water, milk and food. For example, was there pasteurized milk, and all these kind of questions. There were 3-4 page questionnaires. And
that you guys made up.
Yes.
Incredible.
What's amazing is they answered.
Yes, many answered. So
that's
we always contacted all 3 of them.
Yeah.
So if sometimes 2 answered, sometimes all 3 answered, and sometimes only 1 answered.
That's incredible.
But it was very, very important and very good information we collected like that. And this turned into our world climate and food safety charts. And it covered 1,440 cities around the world.
And
That's incredible.
who transcribed all that information from the letters, the questionnaire you received?
Mostly I did.
Pre-Excel spreadsheet. Pre everything.
And it was, information was in both Celsius and Fahrenheit. And
You had to convert that.
yes. And the data for the climate was 40-year averages, which we had to calculate. You could get every year, but it wasn't calculated in averages.
Amazing.
So we did all that.
So if we look back in your files, we can easily document what we've done to the climate in the last 40 years.
Yes, we can.
That's incredible. Yeah. So then, after you wrote these letters and contacted these embassies, did they start inviting you to their countries, or did you start? Because I know you traveled to a lot of these countries as well.
No, it was more our physicians in these countries we visited. So.
And so when you visited, that's when you would start sourcing geography and landscape, and that's when you started creating these maps.
Yes.
And you drew the maps as well?
Yes, I drew the maps. Yeah. I didn't do the pictures like a Chagas disease hat or things like that, but I drew the maps.
So who did the pictures for the life cycles?
A niece of my husband's.
Really? And they're beautiful. Like if we pull past me that binder, I was looking at, they have the schistosomiasis life cycle in there. That's incredible. Yeah. And these would be documents and leaflets that would be published for travelers as well as physicians.
Yes.
This is fantastic.
So this is the one for Chagas. You can see the picture. And on the back, you can see the kind of houses that people live in that get this disease. So it's very, very interesting and very helpful.
And detailed.
Yes. And we update it every year.
Every year.
It was a Work of love, but a lot of work.
Yes.
How big was your team at the time?
We had 5 people helping us, and then some volunteers who helped with the mailings.
That's incredible.
Amazing.
What would be one of your most memorable experiences, or one of the things that you and Dr. Marcolongo did that you think has been the most impactful at this point?
One highlight for me was that in 2020, we could start to give scholarships for training in travel medicine. And we are giving now one scholarship for South Americans. They can go to train at the London School of Tropical Medicine and Hygiene in London.
That's fantastic.
And we have 2 scholarships in South Africa. This is for Africans. And then we have 1 scholarship for Southeast Asia. And so, yes, this was a highlight of this was actually what Vincenzo wanted to do, but he didn't have the opportunity. And in 2002, I could start with the first scholarships.
That's really fantastic.
And we have now given out 50 scholarships so far.
Fantastic.
Also, another highlight was my travels to China. We, Elaine Zhong and I, we were able to travel to China, and we started to teach them for in and outgoing people, for coming in and to go out, because they sent so many people overseas. And we started to teach them with a new system we had, case studies. Mm-hmm. We taught them first case studies in travel medicine.
Fantastic.
And Elaine Zhong's tropical medicine manual was translated into Chinese, and I was able to represent her there when it was published. This was also a highlight, because this is the only book which was translated into Chinese.
So Elaine Zhong is a tropical medicine and travel medicine specialist from Seattle, and she's one of the world leaders with respect to travel medicine.
Yes.
Tropical medicine. So that's so impressive.
Yeah.
And so you traveled to China, you said up to 20 times.
20 times, yes.
And you've been all over the world.
Yes, more or less.
What would you say has been one of your more favorite destinations? And also, what would you say has been one of your more challenging destinations in regards to the work that you were doing?
I think Peru was a highlight, and Bolivia. And these 2 countries, and then China was a highlight. What difficulties did you and Dr. Marcolongo come across? I mean, this is not easy work, and this is, a lot of dedication and commitment, and also the reliance on people to provide you information, and the trust that people would give to you to go in to look through their work and archives in their countries. So I can imagine you may have had some resistance, but maybe not. I don't know. Maybe you were just on a roll. Like, what would you say would be your biggest difficulties in that area? Yes, that they doubted that we were honest, I guess,
Well, because travel medicine didn't really exist at that time. So the whole idea, and even preventive medicine, wasn't really at the forefront at that point. Yeah. So I'm sure they thought you guys were just trying to make some money.
Yes,
right?
That's right.
Right?
But I have to say, my husband was profoundly an honest person, and it was a pleasure to work with him because of his vision and his ideas, which are still valid today. For example, he talked already many years ago about having maps for where pollen are affecting asthmatic people, but this is still a dream.
Wow.
You know,
That's
amazing.
incredible.
Amazing.
What would you say has been your most cherished publication or your favorite thing that you worked on?
I liked all of them. Malaria was a favorite.
I'm with you there.
Yeah. Yeah.
And where did you learn to draw? Or did you just naturally?
Well, it was, I just like to do it.
You like to do
Yeah.
it. Yeah, we'll have to take a look at some of your maps that you did for sure.
And how I understand that IAMAT has now taken a bit of a change with respect to the risk maps and everything else, in part probably because so much is available via the internet and other organizations.
Yes.
So can you tell us a little bit about how you've changed or decided to concentrate on a certain aspect of what you guys have done?
As you know, IAMAT is a division of the Foundation for Support of International Medical Training. And we have now converted into just giving scholarships. And because you can look up stuff on Google Map and figure out yourself, for example, I use Google Map. When they mention a city I look it up on Google Map, and so everybody can do that now. And so it's less important that we publish things. But I think education is still a huge problem. And therefore we want to invest in scholarships around the world.
And I can attest to that because obviously she's helped by IAMAT sponsoring these podcasts, but also with our Asian Clinical Tropical Medicine course, which we run every 2 years in Thailand and Cambodia. You've helped out with the medical education credits for that and helping with scholarships. Is fantastic.
I also would like to mention that we were the first to actually have supporting at ISTM the mental health programs. Yes. And this is also visionary, because I knew from talking to many doctors that 40% in some countries were cases of mental problems. And nobody had talked about it. And this, I have to say, my daughter Tulia, who was working for IAMAT, was instrumental in organizing this.
Right. So you're talking about 40% of travelers who are seen overseas with an illness. It's something related to mental health. Right? Yes. Whether it's anxiety or whatever.
Yes.
Back in the day, side effects from some medications.
Yes.
And even now it's a big challenge. Like when I was working in New Zealand, I know several cases where somebody had a mental health break or psychotic episode or whatnot. Usually on a gap year, the students would go on gap years for a year and we would do screening before they left. But one of the biggest challenges was if something happened in that country, often to get them back, they couldn't come alone. Yes. And so some of the challenges that we face, I remember we had a student in Honduras and we had to send somebody from New Zealand to go get them, and they had to be able to travel back with them. And I guess this is also kind of where IAMAT and the medical assistance for travelers comes in. But it is quite challenging, right? And often insurance doesn't cover these types of medical illnesses that arise, right? They look at mostly things like injury or hospitalization for infection or whatnot. But often mental health is not something that's covered. Covered.
And we have also on our website is something about what to look for travel insurance, and what is not covered and what it's we have actually a booklet which we produced talking about insurance and what is not covered with insurance.
Because people think they buy something and they think everything, and even things like not only repatriation, but if a traveler dies, how do you get the body back?
Yes, it's a huge
which may
problem.
not be covered, right?
Yes.
So you need to make sure.
Yeah.
And I guess this passion runs in the family too, because I mean, I know Tulia from working with her through the Responsible Travel Group for the International Society of Travel Medicine. But her work on responsible travel as well as mental health can be found under the resources section for ISTM as well. And I know she's done a lot of work with the Pan-African Travel Congress in Africa as well. And so kind of really continuing on with a lot of the legacy and the vision that you guys set up through this organization. Yeah, it's incredible. It really is. It really is.
Thank you.
And thank you, of course, also for this, because it is. So in our culture, we talk about something called Sadaka Jariya, which means it's like a charity that keeps on giving. And these are the things that are kind of left behind when when we depart. But things like planting a tree that somebody else may reap the fruit from later, or, educating someone that they may go on to benefit others. So that domino effect, or that butterfly effect that you'd have from investing in something. And you've really set that up for many, many people. And even with this travel podcast, we hope that education can really disseminate for, travelers as well as healthcare providers, to educate them and to be able to educate their travelers, their families, and the local communities as well that they're visiting. So the impact is wide, and it's very impressive. It really is. So
thank you.
Congratulations to the incredible work, a lifetime achievement of work that you've done, and Dr. Marcolongo as well. It really is impressive, and I just wanted to really have people, understand that and value that and recognize that, and see the work that you've done as well, because I think it's important that we don't forget about that as we move forward. You and Dr. Marcolongo have been doing this since the 60s, and you have been actively involved around the world with different associations. You're involved very heavily with the ASTMH, the American Society of Tropical Medicine and Hygiene, with the International Society of Travel Medicine. These haven't been around since the 60s. So tell us a little bit about the timeline of your work through those years, and what you saw kind of develop over time that you would say would be, pivotal points in history in travel medicine throughout those times.
Well, the first one was the big first jets going overseas from America to Europe traveling. Okay, and this started Vincenzo seeing that there was a need to protect travelers.
When was that?
This was 1960, 59, 60. Okay. And he started then to coordinate doctors who he knew had trained overseas or were looking after travelers. Then the second was our realizations that we had in 72, 73, our realizations that we had to educate travelers about preventing diseases with vaccines and preventing malaria. Right. At that time in the 80s, there were 10,000 travelers dying of malaria a year. And
those were known numbers,
known numbers.
Yeah.
And so this was the biggest shift. And then we came out with the other publications. And then the big sadness was that Vincenzo passed away in 88. And this, when I started to have a memorial lecture for him at the American Society of Tropical Medicine and Hygiene. So it's also 35 years now.
Still exists every year.
Yes.
Amazing speakers.
Yeah. And yes, and they are always very well chosen speakers from overseas to bring their vision to the society. And then I think in this same year, ISTM started. Or was it the year before?
I should know that.
I think it was 88.
88 or 89, I think.
Yeah. And we always supported these conferences too, starting with the conference in Geneva and so on.
Yeah, the Geneva one was the first one I went to, but I think there had been one in Acapulco.
Yeah.
And then did things get easier as technology improved?
Yes and no. The internet was naturally very helpful, and also communication with our members was easier, and so on. We called the donors, we called them members, the people who supported our work. And we would renew every year our publication and send them the new package every year, because there were every year lots of different changes. Mm-hmm. And this was a big thing, to say the least, but helpful. But also, doctors started to make advertisement overseas for their own clinics, so it was less important, and it became less and less. And then naturally, COVID was, well, no, I have to say before 2002 was when I started with the scholarships. This was another highlight. And then in 2019, this COVID disaster. And these were the highlights.
Mm-hmm. So that time period between the 70s to 1988, when Dr. Marcolongo, I guess that was really the prime of the work.
Yes. Yeah.
So was that during that time is when you guys were doing most of your travel and most of your publications and developing the map? So the focus was mostly on that
during this time.
What inspired you to continue after his death? Because really he was the one with the original vision, right? Like he found you and swept you away into this amazing world of travel medicine. What was your desire to keep going after that? Because really, I mean, you could have stopped.
His vision made me continue, because, as I told you before, the Foundation for Support of International Medical Training is actually the overseeing foundation, and IAMAT was only a division of it. And he always wanted that travel pays for education in medicine worldwide. So it was he had a global vision of health, and this I wanted to continue for him. I promised him. Therefore, I was so pleased when we could start with the scholarships.
Yeah, that's fantastic.
Yeah, you're very much paying it forward, right? For the next generation. It's fantastic.
Yeah.
So Dr. Marcolongo was born in Italy, correct?
Yes.
So then he came to Canada to study.
Yes.
And then he went back to Italy.
Yes.
And then he came back to Canada.
Yes.
And you're not Italian, though.
No, I'm Swiss.
You're serving me some beautiful Swiss chocolate. So I know. So you're from Switzerland originally.
Yes.
So how did you meet Dr. Marcolongo? When did you meet? And how did you get involved with this work?
Yeah. I met Dr. Marcolongo the first time in 1971. And he asked, through a friend, I met him. And he asked me to work for him. And
what were you doing at the time?
I was trying to learn English.
So were you in Canada at the time?
Yes.
Or, okay, so
I came to Canada to learn English.
Okay, so that was the reason that you came to Canada.
Yes.
Okay.
And he asked me to look after his office, and he had already established IAMAT and everything, but he needed somebody who did the books for him. And so I started to work for him.
And then the rest is
in 70. Yeah.
And now you're trained as a nurse, correct?
Yes, in Switzerland.
And so were you working as a nurse at that time as well? Or
no. In Canada, I would have to start again from the beginning. And I said, no, I can't do that. I have to work for a living.
Right. And so what were your initial thoughts about his vision and what he wanted to do and the work that he was doing? Like, what did you think of it at that time? Or was it just a job for you?
No, I was fascinated because I was an immigrant and I knew travel and I knew how important it was. And I was fascinated by his vision to do more for travelers. And this started me to work with him.
It's amazing.
And then obviously things developed from there.
Yes, yes.
And so when did you get married?
In 72.
70. That was fast.
Well, it was more than a year after we
Right.
met.
Yes.
Yeah.
Oh, that's lovely.
Yeah.
I think it's important to keep this, and I think it's important that we're able to see it. Like, I think it'd be nice to put it up on our platform so that people can learn about the history.
Yeah.
Well, because a lot of it is still relevant, like your life cycles and
Yes.
the other things
Yeah.
that you've done, the
Yeah.
risk factors
Yeah.
and
Yeah.
stuff, still very relevant
And we wanted to have it available to the travelers.
to everybody. Yeah.
And I think travelers are smarter than we think, you know. Say,
Yeah.
And we always felt it had to be precise.
Mhm. And I think that's even more true now post-COVID, where people really got a little bit more comfortable with looking at medical literature and stuff.
Yes.
You guys were decades and decades ahead of that to try and translate it into understandable material.
Yes.
right?
Not scaring people, but giving them the truth.
Mhm. Mhm.
And also how important vaccines are. This is, I'm really upset when say spread misinformation about vaccines. You know, this is we forget how it was before vaccines. You know,
The age of
especially
polio,
rabies
yeah,
and
yeah.
things like that.
Is there anything else that you would want the listener to know, or any information that you would like to tell us, you know, even as, you know, as we kind of carry on travel medicine education, like what would be your message, or what would be your final thoughts?
I just wish that travelers are not skeptical when we tell them something.
That might be a pipe dream.
Yes, I know. Because I think physicians try to help their travelers, and it is important to protect them properly with vaccines.
And what would you say in all of the history of travel medicine in the last, how many years has it, 65
60
years coming
plus,
up next
yeah,
year
yeah.
of this? What has been one of the biggest successes for you, would you say?
The reduction in malaria cases in travelers
Mhm.
Yeah, absolutely. It's a big one.
and death in
And I
travelers.
think that's right. I think it's travelers knowing and trying to make healthcare providers more aware has really made a difference.
Yes. And this is what Vincenzo wanted.
Yeah.
And he did it with his first malaria risk chart.
Fantastic. Well, this has been amazing. I want to thank you very much for welcoming us into your home and for letting us see this amazing history. It's unbelievable, the archive that you have. And I really would, I agree with Aisha, love to get some of this scanned to sort of, you know, have available historically. It's fantastic.
Well, thank you so much, Assunta. This has really been inspiring and informative, and you know, it makes me more passionate about taking the vision forward and continuing this work, and we appreciate so much your support for all the work that's going on through the International Society of Travel Medicine as well, and outside as well. It's a lot of work. So
yeah, it's amazing.
Thank you.
Thank you.
Thank you for having me and showing you that I was able to show you our publications.
yes, no, I love that.
fantastic.
They were fantastic.
So that's a wrap for this episode. Thank you to our sponsor, the International Association for Medical Assistance to Travelers, located on the web at IAMAT.org. Don't forget to follow Travel Unraveled on Spotify and on Apple Podcasts or on your favorite podcast platform. We'll post fun clips and extra resources on the ISTM website located at learning.istm.org/podcast. We're also on Facebook, LinkedIn, X, and Instagram at _ISTM_. Travel Unraveled is brought to you by the International Society of Travel Medicine. Finally, and thankfully, Travel Unraveled is produced by Ghost Bureau out of Toronto at ghostbureau.com.
Please remember that the information presented in this podcast is intended for educational and informational purposes only. It should not be considered medical advice, nor is it intended to replace consultation with a qualified healthcare professional. The views expressed by the hosts and guests of this podcast are their own and do not necessarily reflect the opinions or policies of the ISTM or any medical or other health professionals, hospitals, clinics, or healthcare facilities. While we strive to provide accurate and up-to-date information, the medical field is constantly evolving, and there may be new findings or developments not included in our content. We encourage our listeners to consult with their healthcare providers for any medical concerns or before starting any new treatment. Neither the ISTM nor any of its affiliates, sponsors, producers, hosts, or guests are liable for any direct, incidental, consequential, indirect, or punitive damages arising out of access to, use of, or inability to use the content of this podcast, or any errors or omissions in the content hereof. By listening to this podcast, you agree not to use this information as a substitute for, nor does it replace professional, medical advice, diagnosis, or treatment. Always consult with your healthcare providers for guidance appropriate to your specific health situation. Thank you for listening to Travel Unraveled. We are committed to sharing knowledge and fostering discussion in the pursuit of better health and well-being.